What's up, guys? Ferdinand here from WolfingPhysique.com, and today I am here with Dr. Gillet. What's up, Cal?
Thank you for having me on. Like you said, if any of you don't know, I'm Dr. Kyle Gillet, like the razor, and I'm a medical doctor. I'm an MD. I'm from Kansas in the United States, and I like to talk about full spectrum health.
Yeah, I am kind of I came across you because of Derek. That's how I got to know you, actually. And you're one of the medical doctors that I really like, to be honest, because let's just say if I go to my doctor and I did my blood work and, I know better, I know something is shitty, he tells me that's all right because it's in a low reference range. But why are you not like that?
Yeah, so doctors are a lot like mechanics. It's not a perfect analogy, but many mechanics are just looking for things that are wrong with your car. And some mechanics, if it's safe to do so, look for things to help your car perform better and also perform for a longer period of time. So, physicians are obviously a heterogeneous product, and there's a lot of information out there, whether it's gurus, whether it's, and there's good and bad of all these. So there's like naturopathic doctors, there's osteopathic doctors, there's allopathic doctors like myself, and then there's dietitians, and there's health coaches. So there's a lot of different people that you hear essentially giving non-specific health advice. And it's hard to find a medical doctor that will talk about some of these things when it has to do with quality of life or health span. So you have your longevity doctors, then you have your longevity gurus. And then you also have your kind of quality of life doctors and quality of life gurus. And there's not a very balanced approach in between all those things. So I feel like I kind of fulfill a little bit of that niche. Derek, he tries to fill a little bit of that niche as well. So I think that's why we partnered for a period of time.
Yeah, I was actually kind of interested because of your knowledge. I can see from the outside that you know a lot. All right, you know a lot, and that's actually why I asked you to come on. But not, like I said, not many doctors have the knowledge that you do, especially about hormones, TRT, testosterone, etc. But how did you? I mean, like, did you study something endocrinology, or did you just did the research yourself?
So I guess there's a little mix of the both. My background, I'm from Kansas, and my dad is a family physician in Kansas. I actually work at the same practice as he does in the same building. So from a young age, I've been exposed to how he helps his patients with individualized medicine. So not necessarily just following an algorithm, but keeping in mind evidence-based medicine. So using the evidence with clinical literature and also expert recommendations, but then applying it to each individual depending on their genetics, depending on what their desires are. And that's been very rewarding for him throughout his life. And it's obviously rewarding for me as well. I enjoy doing this.
Yeah.
And from the time I was, even a teenager, like 12 years old, I've known that I wanted to be a family doctor and also work with him and help people on an individualized basis. So I've tailored my education in that way. So I practice general medicine, and I'm board certified in family medicine as well. I went to a med school that emphasizes primary care. A lot of med schools don't emphasize primary care, and I've had dozens of people tell me that it's a waste for myself to go into any primary care field. They say, do emergency medicine, do cardiology, become a surgeon, but it's just not what I like at the end of the day. So I've tailored my education to be able to do full spectrum medicine and do a little bit of everything. A lot of doctors are very hyper specialized. So you have, amazing urologists that, they're also able to address, depending on the urologist, your hormones as well. And you have amazing endocrinologists and lipidologists and people that have to do with thyroid management. So there's a lot of specialists, but there's not a lot of individuals that can encompass all of those pieces together. So it's like having a football team, football or American football, either way.
Yeah.
So, you know, you have your goalie coach, or you have your punter coach, and you have your offensive coordinator, and you have all these different specialist coach. And, you know, you're either the star football player or the quarterback if it's American football. And, you know, you're looking for a coach that just takes all of that information from all of your specialized coaches and helps refine that based upon what you want to accomplish. So that's kind of why, you know, it's a niche that is untapped. And I think as time goes on and healthcare becomes more and more homogenous across the board, people who want a little bit more, they want like high performance health span, will be seeking out physicians like that.
Yeah, interesting. I try to do that myself as well, just learn from experts on different fields, and I think that's how you develop the knowledge that you have on most things. But we also know that, like, testosterone for men, especially, I know how it is to have low testosterone because I dieted down really hard. Coming back to that later.
Yeah.
But I know how it is. Feeling better now though. But I think most people around the 21st century more are suffering of low testosterone. And I was just wondering, how can people know that they have low testosterone, and if they do, how could they increase it?
Yeah.
Naturally,
So this is a question that essentially everybody probably cares about. Some people just don't want the stigma of asking their healthcare provider about their testosterone. So both men and women should consider getting their testosterone checked, especially if they are not feeling fantastic. But there's a lot of different factors. So, and we could talk about this for a long time, but many people are aware of different things that might be causing low testosterone, anywhere from high body fat to low body fat, endocrine disruptors versus, you know, lifestyle changes, not enough exercise, stress, too much stress, too little stress. A lot of things can cause suboptimal or even deficient testosterone levels in men and women. So getting it checked is the best thing to do. I've seen many people, a lot of patients will come to me for hair loss prevention, and a lot of them feel perfectly fine, and they are clinically hypogonadal, significantly clinically hypogonadal. So, you know, bottom of the barrel deficient testosterone level. So obviously those people, they've learned to cope with it, and they probably have very good androgen receptor sensitivity. Conversely, many men and women come to me with every single symptom of low testosterone, and they have high normal or even testosterone levels above the reference range. In fact, one individual had testosterone levels more than twice the normal reference, like more than twice the upper limit of the normal reference range. So there's a lot of.
Is that normal, natural?
Yeah, he was natural.
Wow.
This individual was also on, I believe, Fedosia and Tomcat, among other things, which apparently were working. But yeah, there's a lot of heterogeneity or difference in between the biofeedback that a male or a female can feel and then what their hormone levels are.
Yeah. Well, we're talking about Tongat Ali. I was actually wondering, are there kind of supplements that could help with increasing your testosterone natural? Something that really works, you know, not like, I don't know, testosterone boosters. There's like zinc in it, but I mean, like, zinc's important for testosterone, of course, but it's not like, I think it's not like it's going to increase it like that hard directly.
Yeah. So the way I think of testosterone booster is kind of a misnomer. So I think of it as testosterone undestroyers. So, you know, they're not boosting, they're just making sure that you don't tank. So it's like low testosterone preventers. So vitamin D is the best one. So, you know, if you're vitamin D deficient, vitamin D is going to be one of the best testosterone boosters that you can take. A little vitamin D, a little vitamin K2, that can have a significant effect increasing your testosterone. If you have suboptimal levels, even if they're not deficient, Things like zinc and selenium and magnesium can make a big difference as well. And then the fat content and quality in your diet. So eating enough healthy fats and, in fact, healthy carbs can make a very big difference. Some people do fantastic with the ketogenic diet. Probably people who have a genetic polymorphism to chronically have low sex hormone binding globulin. Some people with naturally high sex hormone binding globulin, a ketogenic diet or a carnivore diet will increase that even more. And they have deficient free testosterone level. So for them, carbs could be the best testosterone booster, which is crazy to think of because you always think of carbs as decreasing testosterone, mostly due to insulin resistance. So that can also play a part. And then depending on your genetic activity and also your lifestyle and your body fat, there's a lot of things that can alter your aromatase and 5-alpha reductase activity. So creatine, for example, just like creatine monohydrate, 5 to 10 grams a day, can be a very potent testosterone and DHT booster, and potentially a cure for some cases of post-finasteride syndrome as well. So that can be a great testosterone booster. Things like calcium D-glucarate, that can also help control estrogen and also be a testosterone booster, depending on people's prolactin. Something like a P5P, which is activated vitamin B6. P5P is pyridoxine 5-pyrophosphate, or a vitamin E mixed tocopherols, especially the gamma tocopherol seems to be deficient often for vitamin E. That can help bring down prolactin and bring up testosterone. So that can also be a potent testosterone booster. We can talk about cabergoline for a while. Obviously, long-term cabergoline has significant risks, but there's been quite a few studies just where they look at, a group that takes a placebo pill, and then you can look at a group that takes a cabergoline, and also a group that takes a SERM like Novaldex or Clomid. And caber looks quite good as if you're just looking at the endpoint of increasing testosterone.
All right.
So that can also be a pretty potent one. So like past all those, we can talk about things like Tomcat and Fedosia. Tribulus terrestris seems just to help with symptoms perhaps, but not really actually boosting testosterone to a significant degree. Ashwagandha probably helps in people who have cortisol run high pretty much all the time and they don't have that nice pulsatile release of cortisol. So that's a pretty long list of things that can naturally optimize your testosterone without even talking about Tomcat or Fedosia. So those can help in combination, both increase LH output from the pituitary, and it can also help sensitize the LH receptors. So your testes or gonads, or potentially even ovaries, can do more with the LH that you do have. Okay. So they're quite good in combination, potentially synergistic. However, you do have to worry about estrogen receptor modification. It's not a selective modifier like SERMs, but if you naturally run low on estrogen and you're borderline deficient, you probably don't want to consider that combination.
All right. Yeah, and you talked about the guy that has like low testosterone but felt really good. I just want to come back to another question I have for you, and that's about, let's just say that if you have really low body fat, your testosterone tanks. We know that. I experienced it. Lots of natural bodybuilders experienced it. But let's just say that when you go out of the deficit and you eat maintenance calories and you do everything you can to increase it, like getting your fats in, omega-3s, vitamin D, etc., sleeping well, is it possible to stay at the same body fat and raise your testosterone if you stay there long enough?
Yeah, it is possible. So that's, I think the question's kind of related to, can you change your body's set point? So different people have different set points. So when you go through puberty, and I don't know how much we want to like dive into the physiology of puberty, but one of the reasons why people who have higher body fats go through puberty earlier is because they have more fat endocrine activity. So adipose cells or fat cells release a lot of endocrine hormones. Leptin is one of those. Leptin upregulates one of the molecules that's essentially kisspeptin, a peptide that binds to the hypothalamus, has a G protein coupled receptor. And that spike in leptin that's secondary to high adipose tissue in early adolescence will upregulate the release of gonadotropin releasing hormone in a pulsatile manner. That's what that G protein coupled receptor that's associated with kisspeptin will upregulate. So after that's upregulated, you have more pulsatile GnRH secretion, which causes higher FSH and LH, which causes gonadal hypertrophy and relatively early puberty, possibly even precocious puberty if there's enough activity. So when that happens, that set point, like it's my belief that if you go through puberty and you're a higher body fat, you kind of have like a more difficult time. So there's not a lot of studies in this because it's not really ethical to like have two groups of people, make one of them have a really high body fat and then have one of them not have a really high body fat. But if you look at individuals, perhaps like yourself, I don't know what your body fat was during puberty, but like Tristan Lee is a pretty obvious example who's pretty much always been shredded and his set point just seems to be like that. That seems to be pretty reasonable.
I was always a little bit of a fat kid. Nah, not fat. I was a little bit chubby. I also have gyno on my right nipple. People call me out for it, that I'm not natural and stuff. Yeah, that's okay. But during puberty, I noticed I gained so much muscle mass. My libido was sky high. In a really short amount of time, I got so much body hair really quickly. So yeah, I dyed it down. My face that got like it looked like a zombie at this weight. That's the funny thing. So I was lighter than I was before. I gone to like 62 kgs, which is so low, but I was so shredded. So I gained a little bit of fat, and I am still really light. Right now I'm 67 kgs, but I'm getting stronger, and my face at this weight was like sunken in, and now it isn't, but I feel good. So that's why I just wanted to ask you if that's like possible. I wanted to do my blood work to really find out, but I don't know.
Yeah, it is likely possible to some degree. So again, with that neuroendocrine hormone leptin that's produced by fat cells, so many people are familiar with how you can become insulin resistant. You can also become leptin resistant. So if there's a lot of studies in mice about obesity and like body fat set points essentially, and you can overwhelm leptin resistance by administering more leptin, and it can cure obesity in mice. But then when you withdraw the leptin, if they're still leptin resistant, they become fat again. If you give them enough time being at a lean body weight, then you don't have to administer leptin because the mice have regained their leptin sensitivity, and then they kind of have a new set point for their body fat.
All right, interesting. There's so much interesting stuff, but there's not enough research about it. I know how much money research costs, and nobody cares about being shredded. So
that's true. Well, a lot of people like to, but it's definitely hard to get funding for that because it's mostly cosmetic. It's definitely fun to walk around and be shredded. It feels good to have a low body fat, but there's kind of like a fine line or a gray zone between almost a little bit of a eating disorder and wanting to have like the best cosmesis and best quality of life that you can.
Yeah, exactly. I was now about that. Everyone wants to be shredded and stuff, but most can't. All right, they feel like shit and they don't function well. They know it, but they stay there. So they consider TRT at a young age. What is your opinion on that? I mean, like, I have the feeling that lots of people use TRT as an excuse these days, especially young guys that want to be shredded, because only young guys that want to be shredded talk about it,
Yeah. You kind of remind me of, and I'll probably butcher his name as well, but Marin, Student Aesthetics.
Marijn.
Yeah.
Yeah, from
So,
from Holland. Yeah, also.
yeah, you kind of remind me of him a little bit, obviously, but yeah, no, it's definitely fun to be shredded. And I think he's publicly talked about pretty much his entire journey, like TRT, no TRT. And I think that's a good microcosm of the fitness industry. Obviously, everybody loved him before he went through any of that.
Yeah.
And I guess to his credit, he was very public about it. And, you know, like Greg Doucette, he was talking about it, and lots of other people were talking about it, and Derek was talking about it. So that just goes to show that even if someone seems like they're very, very convinced that this is like what they need and it's the best for their profession, because fitness influencers, you know, like that's your lifestyle, that's how you provide for your family, and that's how you earn a living. So some people can make a pretty strong case that even if there's no clinical like issue, if your job requires you to essentially feel horrible all the time, then doing something that is potentially harmful the benefit might outweigh the risk. But in almost every case, including in his case, it appears the risks did outweigh the benefits. So it's something that it's a decision that should require a lot of thought, even before you like tell your doctor or healthcare provider that this is definitely what you need. So a lot of people, especially younger guys, don't look like 20, 30, 40 years in the future. And I think Dorian Yates is another example of someone who has a very balanced, wise approach to this. You know, he's been in the industry a long time. He's been Mr. Olympia. And, you know, he's definitely talked about a lot of the risks of what he's done. Obviously, he was very successful. And I'm sure that he provided for his family quite well by doing the profession that he did. But I think it's good that people in the younger age category listen to people like Marine and Dorian and take those things into account.
Yeah. Are there dangers of being on TRT for some people?
Yeah. One of my theories is that pretty much everybody that goes on TRT gets at least some side effect. You know, the insidious ones are the most worrisome. So you mentioned gyno earlier. You know, the ones that people think of is gynecomastia, prostate hyperplasia, trouble peeing, hair loss, skin problems like acne. So people are pretty aware of those problems, but the insidious ones that are not really known of are more concerning. So potential risk of blood clots, potential risk of heart disease, potential risk of plaque buildup, potential risk of growing a prostate cancer that you might not already know that you have, or growing other cancers. So there's a lot of risks. People know about the fertility risk, subfertility, if not infertility. So, you know, it's my belief that maybe someone goes on TRT and has very minimal side effects and has amazing benefit, but theoretically it does build up plaque. However, if you take hypogonadal men, so, you know, a male that is truly deficient in testosterone, not transiently from like SARM or anything like that, but truly hypogonadal, and you give them TRT, their incidence of heart attack and stroke actually decreases, and their incidence of diabetes decreases. So it's highly individualized. Almost everyone has a pretty significant risk of a side effect, but many individuals have, I guess, more benefit that they could potentially have.
Wow, that's I didn't know that, actually, to be honest. But yeah, that's why I was asking. I mean, like, lots of people blast, and we know that's unhealthy, but well, what about TRT? Because you do have a chronic bleed of testosterone in your blood. You don't have these spikes, downs. And while we were talking about prostate cancer, I actually didn't mention it on my channel, but my dad has prostate cancer, like we found out recently. I got to the doctor there, and you have like two ways to get rid of it. We were there a little bit early. You can do in like an surgery, or the therapy, not chemotherapy. What's it called in English?
Radiation.
Radiation, exactly. That's the word I was looking for. Yeah, radiation. And what they told me was that the part of the radiation was we're going to inject testosterone while we're doing the radiation to make it more effective. Yeah, that's pretty interesting. I thought that was interesting, but he has to go off after 2 shots. So then he has to walk around hypogonadal for like, I don't know how long, because they are not implementing a serum or nothing like that. And I honestly asked it, why are you not using a serum? Why no tamoxifen or something like that? And he was looking at me like, wow, how do you know that? You know, and he was telling me that, no, we don't do that. We don't like to do that.
Yeah, I believe the injection of testosterone is, if it's truly testosterone, would be similar to people who do like a huge cycle of DECA, D-bol, and testosterone right before their gynecomastia surgery, basically just to like hypertrophy the cells as much as possible so that they can be removed as easily as possible. Sometimes they'll also give shots of things like Lupron, which is kind of like triptorelin or gonadorelin. It's a GnRH agonist or analog, and that kind of shuts down the pituitary, so it helps shut down testosterone production. So testosterone does not truly appear, and there's still somewhat of a debate about this, but it does not appear that testosterone causes prostate cancer. Aging and perhaps even normal aging in men seems to cause prostate cancer. There's just various levels of aggression. So some prostate cancers are much more aggressive. If you look at the average 80-year-old who passes away, and you do an autopsy, then 70% of them have a prostate cancer, but less than 3% died of it. If you look at 100-year-olds, greater than 90% of them have a prostate cancer. So it's more of a question of when and not if a male will get a prostate cancer.
Wow. But because my dad has it, should I watch out?
Certainly.
Yeah. All right. So I do need to check that the health marker. It's called the PCA, if I'm right.
PSA.
Yeah, PSA.
Yeah. PSA. Yeah. Probably starting around 30 to 40 or before, if you ever choose to do something or need something after talking with your healthcare provider, like TRT, before that, of course, as well. But yeah, it's interesting because hypogonadal men, especially with very high estrogen, seem to have higher rates of prostate cancer. So perhaps estrogen has some sort of causatory link, but it's probably secondary, because if a man is truly hypogonadal with low testosterone and high estrogen, they probably have high aromatase from, a high calorie diet or obesity or insulin resistance or something like that.
All right.
So yeah, it's a complicated topic, and why I love co-managing patients with urologists much of the time.
Wow. That's very interesting. But testosterone is like, if I look at successful people, if you look at Jeff Bezos, I don't know, Elon Musk, all those guys, I guess they are on testosterone. I think people who have knowledge about it, they know as well. But are you on testosterone actually? And why, if you are, why are you, or why not?
Yeah, so this is kind of a difficult question to answer. It's natty or not on many people at the same time. So I'm definitely doing things to optimize my testosterone, and I'm sure that Elon Musk and Jeff Bezos and whoever else cares about quality of life is doing things to optimize their testosterone as well. A lot of people are on things like maybe just HCG monotherapy. It's a lot less suppressive, and it helps maintain aromatase activity. So if someone has a very low level of aromatase, for example, myself, there's even genetic, somewhat aromatase deficiencies that can make it more likely for low bone mass to run in your family. So obviously I don't know the genetics or the health history of Jeff Bezos or Elon Musk. And even if I did, I couldn't say so. But I'm sure that they have very capable physicians or team of healthcare providers that is ensuring that they feel as good as possible all the time. that their cognitive function is as good as it can be all the time, and that their body composition is relatively good, like within their genetic limit, and also within the limit that they're willing to diet and exercise.
Yeah, if you look at the picture from before of Jeff Bezos and now, the dude is absolutely jacked. Like, it's insane. It's wow, for real. But what did I want to say? Actually, but you are not on TRT or that kind of stuff, right? Or are you?
I'm hesitant to talk about my own personal medical history because there's a lot of confounding variables. And if I say anything specific, then people will take that as a reason to, basically do. So there's 5 types of people. There's, and I'm not the one that popularized this. I think Huberman said there's 5 types of people. There's the ones that say, tell me what I am doing is healthy, it will not hurt me, and that I should do it. So that's type 1.
Yeah.
They're obviously quite difficult to work with. Type 2 is tell me what you are doing so that I can copy it without you telling me what to do. And I'm just going to do whatever you're doing. So those people are also very difficult to work with. Type 3 is, show me what the animal studies are. If it's good enough for a mouse, it's good enough for me. So the quartering crew, I suppose. Not that it's evil or anything, but that's type 3. Type 4 is show me the human studies, and whatever is good enough for the human studies, I'm good with that. And then type 5 is kind of like so those are the first 4 are, I guess, technically shared decision making. The 5th one is medical paternalism. So this type of person says, just tell me what to do. I don't care about literally anything. Doc, just tell me what to do based upon my individual situation. Not any of these is right or wrong, but knowing which one you are, the first 2 aren't ideal, obviously. Mm-hmm. But the last 3, just kind of like realizing which one you fit into. Most people at least want to talk about the human studies to some degree. And a lot of doctors like to operate with those type 4 people, I suppose. So it's important to know which group you fall into.
Yeah. All right. I totally understand that. There are really people like that. But I wanted to ask something about, I have some clients that are on gear, all right? So they are doing PDs and stuff, and I never judge them. But previous coaches of them, they always seem to say that, all right, if you go on, you do this and this and this, all right? It's totally not personalized, and sometimes it just doesn't make sense. We all know it's bad if you're blasting. But after they tell them, okay, go off and do PCT with the goal to go on later on. But I think, I don't know if it's true, but is it true that when you go off, I mean, like, you're shutting yourself down if you're on PDs, all right? So if you go on and off and on and off and on and off, are you just not wrecking your endocrine system? Is it not just better to just stay on TRT then, if you're going to blast anyway later?
Yeah, so if you're going to go on and off more than about, in a hypothetical world, more than about 3 or 4 times, it probably is a higher harm, and it would be relatively, reasonable for harm risk reduction to go on a nice even dose where your levels are in the reference range for both free and total testosterone in between cycles. So if you're going to do it once a year and you're only going the classic, not bro split, but bro cycle, I guess, is every spring do a cycle and then use a DHT derivative later in the spring to get a little bit shredded and have a little bit of cosmetic for summer beach time. Mm-hmm. And then the rest of the year you go off. It probably is better to come off and, only do that once a year. So there would be, other than just maintaining slightly more muscle mass year round, there wouldn't be a reason to go through TRT. you know, some of that depends on what their baseline is as well. So if there's an individual that is quite hypogonadal, let's say they have a total testosterone of 80, and you know, they need TRT and they go on TRT and they want to get a little bit shredded for summer, obviously a safer option is to utilize things like you know, safe appetite suppressants. So maybe an alpha yohimbine or a rauwolsine. Utilize that in the spring, you know, go on a diet, and maybe they add a bit more muscle as well. Maybe they utilize some L-carnitine or some ecdy steroids. And then instead of having to do a, you know, a blast and cruise phase or whatever the term is, then they can have their optimal body composition. They can be a little extra shredded for the summer, safely as well. And then they can also address their hormones year round without having to go through peaks and troughs. It's almost like an addiction cycle where the rest of the year they're just looking forward to that spring when they can have the body composition that they want, rather than being happy with a relatively similar body all the year round. So maybe bigorexia should be, when we have you know, the next meeting to decide, you know, is this pathologic? Is this next is this pathologic? Maybe at some point it will be a disorder, but that's some things that people can do to both reach their goals and be as safe as possible with it. Another point on that, if they have a coach or a guru or whatever you call it, a lot of them are quite expensive. And if you're like devoting those resources and trusting that coach or guru with your health, you should probably also find a healthcare provider or physician that is fairly knowledgeable, that's able to oversee your health and not just things that can alter your body composition.
Yeah, exactly. So cycling on and off more than like 6 times is not beneficial, by your opinion, for no.
Short answer, yeah, don't cycle on and off 6 times. In fact, if it's like 1 or 2 grams a week, then by the time you've gone through enough half-lives, you know, depending on the ester and the oil, of course, but mostly the ester, after enough half-lives, then you're probably just about to start your next phase as well. So you probably haven't actually cycled off. You've just spent 6 weeks of the half-life of the ester being cleaved, and now you're just barely ready to start coming off when you start your next one. So yeah, in a lot of cases, especially if you have a really long acting compound like a decanoate or an undecanoate ester, you know, it's going to be literally months when you still have clinically significant levels of androgen that are suppressing your hypothalamus and pituitary.
Interesting. Yeah, you see this a lot in the TRT community, that you have like people that are depressed and they go on testosterone and they feel great, you know. I was always wondering, what is the mechanism of action of why testosterone makes you undepressed? Because I got a question from a follower. He has like PCS. He had a big hit on his head and he tried a lot and he doesn't really feel good, like mentally. And he thinks testosterone can help him, but after blood work, his total testosterone was fine. Only his luteinizing hormone was a little bit on the lower end of normal. Just say that. How is it possible? And should this person consider TRT? I don't know. I just don't know what testosterone does with your brains that it makes you feel better.
Yeah, so testosterone and dopamine are close cousins. I think Andrew Huberman popularized that saying, but it's very dopaminergic. So if you think of other things that are dopaminergic, then it kind of makes sense. So a lot of men that are depressed, they go on something like a Wellbutrin or a bupropion. That's a dopamine reuptake inhibitor that can also increase dopamine. Secondarily, testosterone also is active in the central nervous system. You know, SHBG is actually one thing that helps testosterone cross phospholipid bilayers. Examples of phospholipid bilayers is any cell membrane, including your brain cells, and also the blood-brain barrier. So when it's bound to SHBG, it's the sterol ring is carried over, and that makes it able to, like interact with the nuclear capsid, cause gene transcription, cause that resilience effect. So that's also likely something that helps. It's also likely why men who are hypogonadal, and I've seen this anecdotally, that they go on TRT because they have like a truly clinically significant hypogonadism, and concurrently, let's say they start ligand draw or like LGD or S4 or a SARM, a selective androgen receptor modifier. It crashes their SHBG, maybe it crashes it down to 5, and they have way less of that binding protein to actually carry testosterone across membranes to help it have its effect. They have less of that dopaminergic response. So perhaps that's less dopamine synthesis and release in the substantia nigra. Perhaps that's just related to the effect of testosterone in the genes in the brain. But people seem to not have near as much of the neurologic benefit. In fact, a lot of people have a spike in anxiety when they start TRT. It seems this is more often in people with low SHBG, and this is anecdotally. They have a harder time getting the cognitive or nootropic benefit of TRT. So there's actually a lot of entrepreneurs that start TRT because they want the cognitive benefits, and let's say they're deficient or extremely low, and they don't get that because they have not enough SHBG, and that needs to be addressed.
Wow. You learn me a lot, Kyle. I got to be honest with you. It's very interesting, the knowledge you have. Bouchons to you. How important is blood work? Like, lots of people just don't do it. I'm a big believer in blood work. I tell my family, my girlfriend, everyone, but they're like, no, just leave it. I just never get that. But how important is blood work? Can you just tell the people that are watching how important it actually is and why?
Yeah, so blood work is how you get an objective finding. So how you feel, I call that biofeedback. So, it's great to know how you feel, and it's good to be in tune with your body. That's very valuable data, but at the end of the day, it is subjective data. So it's important to have objective data. Those are your vitals. Those are, the examination findings when your healthcare provider or physician does the exam on you when you go into the doctor, and that's your blood work. So they can help confirm what you think. So guys ask me all the time, like, I'm just not feeling great. I have a little bit of every symptom. Is it my testosterone? Is it my dopamine? Is it my serotonin? Is it my thyroid? And a lot of times you don't know until you get that objective data. Also, everybody starts at a different threshold. Everybody's receptors have different levels of sensitivity. So it's important to know what your baseline is. So even if you feel totally fine, a comprehensive lab panel when you're fasting, and likely one when you're not fasting as well, to know low tide and high tide, that's going to tell you in the future if something or when something is suboptimal, you can address it and objectively know what it is.
Bless you.
Yeah, so very important.
Yeah. I heard this a lot about heart rates, about the next thing I wanted to talk about. Like, lots of people are like, they are interested in longevity and stuff. They want to live a long, healthy life. Most often, bless you, most often you see something that I notice is lots of old people are like really thin and slim and small. Yeah, and also people, if you look at me, I have a really low heart rate, resting heart rate. It's around 45 beats per minute. But is it true that if you have a low resting heart rate, that you're likely to live longer?
So theoretically, it is true. That's trying to get at the concept of your heart only has so many beats. And when it's had those beats, the cellular aging of the heart has ended. That does not appear to be a rate limiting step of aging currently. So perhaps in the future it is, hopefully in the future it is. Like the concept that a lot of older individuals are very thin. So if you look at someone who is in the middle ages and they're obese, if they lose weight slowly when they're in their older ages, the incidence of dementia and neurodegenerative diseases like Alzheimer's significantly increases. If they maintain their weight, they're still obese, even an unhealthy weight, the incidence of neurodegenerative diseases is low.
Bless you.
Sorry about that.
Yeah, no problem.
Yeah, lots of talking today, but there's several reasons for this. One of it's micronutrients. One of it's healthy fats. If you look at the brain of someone with Alzheimer's or dementia, it's shrunk up. There's a lot of fluid in the skull, but very little actual brain tissue. So you need myelinization of these neurons. Several things help with myelinization, but myelin is essentially a fatty sheath that goes around your brain. And you need serotonin to help form myelin. You need estrogen to help form myelin. In fact, estrogen is what helps masculinize the brain. So theoretically, women who go on estrogen replacement therapy after menopause, that can help maintain myelin in the brain. And that's a tertiary reason why aromatase inhibitors are not a great long-term strategy unless you have a cancer to where you need to take one. So if you look at things that prevent dementia in an aging population, resistance training is particularly good, especially in concert with cardiovascular training. So another common type of dementia is microvascular ischemic dementia. It's where the tiny little blood vessels and capillaries in the brain get clogged and the brain cells do not have as much oxygen, so they just die. And that contributes to the shrinking of the brain itself. So with that type of dementia, obviously increasing the blood flow through things like exercise can help. But increasing, like muscle mass, increasing your metabolism, that's going to increase your overall food intake as well. It's going to maintain the density of your bones. It's going to maintain the density of your muscle, and it's going to maintain the density of your brain.
All right, interesting. I have another question. It's something really funny. I don't know how you think about this. This is the last one, but it's about when you go in the fat loss phase and you lose a lot of weight and you get really light. Something that I experienced, like every time I cut it down, so it was always so cold. So when I did my blood work, I thought maybe you are cold because of you're less insulated, but my thyroid stimulating hormone was really high. So I thought that is the reason, I guess, right?
Yeah, so I actually just posted this about this on my Instagram earlier today. So your hormone thyroid axis is very important. So the more estrogen you have, the more that's going to increase your TSH. The more androgen you have, the more that's going to potentially decrease it. So if you were hypogonadal, just that could have caused the increased TSH through a feedback mechanism that has to do with increasing thyroxine binding globulin. So thyroxine binding globulin is basically SHBG, except for thyroid hormones, T3 and T4. There's another reason for that too, independent of thyroxine binding globulin. So when your body has less nutrients to intake, you probably have less iodine and less quality of iodine. So it takes more agonism at the TSH receptor to cause release of the same amount of T3 and T4. In fact, many natural bodybuilders that I see that have dieted down to true single digit body fat, many of them are clinically hypothyroid, some significantly. So You know, having enough iodine is a good source. Selenium is also an important source. So selenium helps for one of the tissue-specific deiodinases. So many people are familiar with how there's 3 different types of 5-alpha reductase enzymes. So there's type 1, 2, 3, and 4, finasteride blocks 2, dutasteride blocks 3, et cetera, et cetera. There's also 3 different types of tissue-specific deiodinases. One of them is dependent on selenium, so that's why selenium is such an important cofactor. The second one, so deiodinase enzyme type 2, specifically works on brown adipose tissue. So, you know, a lot of people will just take T3 because they don't have to depend on tissue-specific deiodinases. But, you know, optimally, you're having your body convert T3 to T4 in each tissue as it wants it. So if it wants to have that T3 active, then it can, and that's how it activates thermogenesis. So only deiodinase enzyme type 2 will help your body with thermogenesis. If you take T3 alone, then you're having a lot of activity on type 1 and also type 3. I believe type 1 is in your central nervous system or your brain, where you don't even want that activity if all you want is the thermogenesis. So it's like using a shotgun or like a big fishnet when you're just going for one specific effect. So that also has a pretty significant effect where you're just having less thermogenesis. So you feel cold because you have less tissue-specific deiodinase enzyme 2 working.
Wow. Great podcast. We're at an hour right now. I just want to tell everyone that are watching, follow Kyle. I mean, like, the information he provides is like, I'm just surprised. You know a lot, and you deserve a lot of followers and a lot of people you can help, because you do a great job with that. Yeah, where can people find you? Because you're no longer associated with Merrick, right?
Yeah, so people can find me on Instagram. My handle is Kyle Gillet, MD. Gillet's like the razor with the E shaved off. Yeah, at some point I'll have my own website and such as well. Obviously, I still see patients in Kansas City if you happen to be from Kansas or Missouri. But at the end of the day, I always tell people the only reason why I'm here is to help. So I feel that doing podcasts like these can help a lot of men and women, and hopefully it's made a difference and given you some impetus to go get your biomarkers checked and you know, take charge of your own health. It's the best investment that you will ever make.
And I can agree with that a lot. Kyle, I really want to thank you, man. I really appreciate you coming on.
My pleasure.
Hey guys, subscribe to me and follow him. Don't forget it. I'll put it down below.